क्या स्टार्ट नहीं हुआ अभी तक? हाँ, नहीं हुआ अभी तक। Hello, my dear students. Welcome to FMGE Accelerate. Welcome to Forensic Medicine and Toxicology. Yeah. So, yes, Namaste Medical Forever, Deepu Singh. Yes, let's start the previous year questions of FMGE exam. Okay. So, as you know, forensic medicine is one of the schools, one of the minor subject, but it is a scoring subject. It's very easy. Let's start with the previous year questions of FMG exam. Let's start with the 2021 previous year questions. Okay. Yes. Yes. Harsh. Harsh. Beta Harsh. Deepu Singh. Swapnashri. Yeah. Let's start with the first question. Let's make it interactive. Okay. You need to answer each question and can be asked in your upcoming exam. The question number one, Barbario test is used for the identification of which of the following? Which of the following? Yes, can answer this question. Options are CSF, species, semen, and the blood. So, what is the best answer? Yeah. Yes, my dear students. So, Barbario test. Remember Barbario test. So, it is the test for the semen is the correct answer. Semen. Yes, my dear students. Yes, I'm audible and visible now properly. Yes, my dear students, I'm audible and visible. Yes, my dear student. Yeah. Barbario test is used for the identification of which of the following. Your answer should be that is semen. Very good answer. So, very good answer. Yes, you are right. Pawan Singh, you are right. Yes, Deepu Singh, you are right. So, the answer for this question is semen is the correct answer. Why not species? You know, species we use precipitin test. The species we use precipitin test. So whether it is a human species, animal species, for that we use a test known as precipitin test that can be asked in your FMG exam. So what is the test for the species identification? Your answer should be that is precipitin test. Blood. See, blood again, it is asked in one of the exam. We are going to discuss in detail about the blood stain at the end. So, blood is also not the answer. CSF, that is also not the answer. So, your answer should be that is the semen correct answer. Semen, that is the correct answer. So, we use picric acid in Barbario test. Picric acid combines with the spermine. It forms spermine picrate crystals which are yellow in color. They are needle shaped. That is very, very commonly asked in the exam. Please remember this point. This can be asked in your exam. Let's discuss about seminal stain. Let's discuss about seminal stain. Seminal stain, remember what it contains. The seminal stain that contain prostatic secretion, that contain seminal vesicle secretion, that also contain spermatozoa. What is the importance of seminal stain in forensic medicine? Can you guess, my dear students? What is the importance of seminal stain in forensic medicine? Why is it needed? Yes, can you try this question? Deepu Singh, Harsh, yes, yes, Swapnashri, Harsh. What is the importance of this seminal stain? So I am giving you an image there, a very famous web series, Delhi Crime. It was related to rape and murder. So it is important because some offences, especially rape and murder, seminal stain acts as a trace evidence. It is one of the very important evidence in proving the crime. So seminal stain, what are the tests for seminal stain we conduct in forensic medicine? The mnemonic is A, B, C, D, E, F, G. Let's start with the what are the important tests. The first one, acid phosphatase. Acid phosphatase, it is the non-cellular marker that is present in the seminal stain. The level of acid phosphatase, that is almost 500 times more than the other body fluid. So acid, A for that is acid phosphatase test. So this can be asked in the exam. Acid phosphatase is one of the commonly used test in detection of seminal stain. And nowadays we use one more test that is known as glycoprotein P30 test. That is also can be asked in your exam. One more A, the mnemonic is A, B, C, D, E, F, G. A for acid phosphatase and one more A, that is ammonium molybdenate test. Ammonium molybdenate test. Anyone can you guess? Anyone? Deepu Singh? Anyone can you guess? What is the role of ammonium molybdenate test? I use simple English, better don't worry. Okay, whenever it is needed, I'll use Hindi also. So ammonium molybdenate test, the test which detects phosphorus. So this can be asked in your exam. Phosphorus. Okay, so the phosphorus present in the seminal stain that can give yellow in color. That yellow color that can detect the seminal stain. Okay, A for acid phosphatase and A for ammonium molybdenate test. What is B for? B for we discussed already, Barberio test. Barberio test. We discussed already, in case of Barberio test, there is a formation of yellow needle shaped crystals. Yellow needle shaped crystals like this. So whenever in exam, yellow needle shaped crystals are given, your answer should be that is Barberio test. That will detect the prostatic secretion, that will detect the spermine. So there is a formation of spermine picrate crystals. They are yellow needle shaped. C for, anyone can you guess what is the C? Beta Deepu Singh. Beta Deepu Singh. C, can you answer? Can you try this? What is the test which starts with the C in seminal stain? Because seminal stain is very commonly asked, beta. So let me ask Deepu Singh and Harsh, what is the test which starts with the C? Yes, C for, let's see who is going to answer. Yes, C for one test that is used in old blood stain also. Even up to 6 months, this test can be used. If the question asked in exam, the test used in old seminal stain. So what is the answer for this question? Your answer should be creatinine phosphokinase test. So what is the answer? Creatinine phosphokinase test. Okay. And one more test is there that is known as, that is also starts with the C, Christmas tree staining. Christmas tree staining. So where you will see the spermatozoa. If they ask you an exam, what is the confirmatory test? your answer should be Christmas tree staining of spermatozoa. So that is the correct answer. Okay, next. Next is the D for. D for one very specific test that is known as lactate dehydrogenase test. So D for that is lactate dehydrogenase test. All these are the tests for the seminal stain. Lactate dehydrogenase, that is one of the most specific biochemical test used in detection of seminal stain. And one more question asked in the exam, especially in FMGE exam, how to detect dry semen, dry seminal stain, which can be detected by using UV rays, by using Wood's lamp. Okay, then E for ELISA test, very simple, and F for Florence test. So this is also asked in one of the exam. Florence test. Florence test. Okay. In Florence test, there is a formation of dark brown crystals. In exam, the question is given and the point is dark brown rhombic crystal. Your answer should be Florence test. Example, so this is the Florence test. Say how the crystals are visible. The crystals are visible like this. Okay, brown rhombic crystals. Like this, the crystals are visible in Florence test. One more test that starts with the F, FISH, that is the fluorescent in situ hybridization technique. Then the last one, that is a G for glycoprotein P30 test. Glycoprotein P30 test. So this can be asked in the exam. My dear student, remember, seminal stain is a very important evidence in proving rape and murder, or in case of rape. So seminal stain, the mnemonic is A, B, C, D, E, F, G. A for acid phosphatase, B for barbario, C for creatinine phosphokinase that can be used in old seminal stain, D for lactate dehydrogenase test, E for ELISA, Florence, lastly glycoprotein P30 test. If the question asked the most specific, your answer should be Christmas tree staining. Most specific biochemical test, your answer should be lactate dehydrogenase test. Most common test, your answer should be acid phosphatase or glycoprotein P30 test. Yes. Fine. Now let me ask you this question. There are some image based questions. There are 5 images given to you. I'll give you around 30-second time. You need to answer these 5 images that is given in this slide. So what is this test A? What is this test B? What is this test C? And what is this D and E? Can answer this, my dear student? Seminal stain is very commonly asked in FMGE. Please concentrate. Yes, come on, try. Come on, try. Yes. Dark brown. What is A? What is A? Abhishek Kumar, Deepu Singh, Rahman, Medical Forever, Swapna Shri, Deepu Singh. Can you try all these 5? So dark brown rhombic crystal. What is the answer? What is the answer, beta? Beta Abhishek, what is the answer? A. What is the answer? So A for that is Florence test. So A, that is Florence. Okay. Florence test here. What is B? So the B that is, you can see the yellow needle shaped crystals, barbario test. C, you can see the purple color. So whenever you see the purple color, simple test, it must be glycoprotein P30 test. So glycoprotein P30 test. What about this D? D for you can see the hematoxylin eosin, that is spermatozoa. So this is Christmas tree staining. Okay. And E, this is dry cement, which is visible under the wood slab. You can see the whitish blue color. So that is nothing but seminal stain that is visible under the wood slab. So all this can be asked in the exam. Okay. So hope this is clear. Topic number 1, that is clear. Topic number 2. Yeah. Now this question asked in FMGE 2021. Hanging from the low level. Okay. Hanging from the low level means partial hanging. And the strangulation. Strangulation. So it can be ligature strangulation. Here the question asked about the ligature strangulation. Will show some similar reports in the post-mortem report. So that is one finding which is common in partial hanging as well as in ligature strangulation. Which of the following can be seen as similar? A bit tricky question. Can you try this? So what do you mean by partial hanging? So partial hanging means the part of the body touching the ground. Ligature strangulation by using a ligature, you will see the transverse ligature mark in ligature strangulation. So what is the answer? Can you try, all of you? Can you try? Yes. Stasis on the dependent part? False. No, it is not the answer. So the stasis, the venous stasis, so that can occur in the lower part of the lower limb, lower part of the upper limb in case of hanging, when body is suspended for some time. So that is not the answer. Face pale in color. The face in case of hanging, especially in complete hanging, it is pale in color. But in partial hanging, it is somewhat reddish in color. You can say the congestion of the face in case of partial hanging. So D is not the answer. Hand touched the floor, not the answer. So what is the best answer? Your answer should be ligature mark is transverse. So ligature mark is transverse. Transverse ligature mark can be seen in partial hanging. It can be seen in ligature strangulation. So my dear student, the answer for this question is ligature mark which is transverse. Let's discuss how exactly ligature mark look in case of hanging, look in case of strangulation. Okay. Yeah. Hanging, how it looks in case of hanging. So hanging, most of the time, it is oblique in nature. Most of the time, in case of hanging, ligature mark is oblique in nature. One exception is the low point of suspension, that is the partial hanging. And in hanging, ligature mark is above the thyroid cartilage. Above the thyroid cartilage. In case of strangulation, it is at the level of thyroid cartilage or below the level of thyroid cartilage. So in case of hanging, above the level of thyroid cartilage. And in case of hanging, it is incomplete ligature mark. It is incomplete ligature mark. So complete ligature mark, that is seen in case of ligature strangulation. Incomplete ligature mark, that is seen in case of hanging. So remember, in hanging, ligature mark is oblique in nature. Like this is oblique in nature. It is above the level of thyroid cartilage. So example, this is thyroid cartilage, above the level of thyroid cartilage. And it is incomplete. So opposite in case of ligature strangulation. Yes. Now look at this. Look at this taken from the standard textbook. Standard textbook. How exactly the ligature mark looks in case of hanging and strangulation. My dear students, this is very commonly asked in the exam. Please concentrate. In hanging, the direction is oblique. So direction is oblique. So this is oblique direction. So this is oblique direction like this. So oblique, and that is in case of hanging. Transverse in case of strangulation. Transverse. Transverse means like this. Transverse. Okay. Transverse in case of strangulation. So that can be asked in the exam. What one exception is the partial hanging. In partial hanging, low point of suspension, when running noose is applied, in all this condition, even in case of hanging, ligature mark can be oblique in nature. Second, continuity. So continuity, non-continuous in hanging. In case of hanging, non-continuous. We discussed it is incomplete. Continuous in case of strangulation. Level of neck, that is above thyroid in case of hanging, at below thyroid in case of strangulation. And if you see the base is pale, hard, and a parchment like. So it is a type of pressure abrasion. When you see the base is pale, it is hard, looks like a parchment paper. So remember, this is very commonly asked in the exam. But in case of strangulation, it is soft and reddish. Soft and reddish. When you do the dissection in autopsy, when you open the ligature mark is dry, hard, glistening in case of hanging. It is soft and reddish. There will be hematoma formation, extravasation of blood in case of strangulation. So this is what you must know. So this is the typical case of hanging. And you can see here in this case, it is oblique, it is incomplete, it is above the level of thyroid cartilage. That's why it is hanging. Look at this. Anyone can you guess? What is this? Hanging or ligature strangulation? Look at this. It is soft. It is reddish at the level of thyroid cartilage. TC, thyroid cartilage, and it is transverse. So my dear students, what it is? It is a hanging, or is it a case of ligature strangulation? Can you guess? My dear students? Yes, come on. Mohit, Rohila, Harsha. Okay. Askar Pandey. Yes, come on. Yes, anyone, can you guess? So, yes. So this is the typical case of ligature strangulation. Okay. Next. Now, next question. Yes, good. Dr. Yogesh Kumar, you are right. So it is a case of ligature strangulation. Now look at this question. My dear student, I am giving you one more image-based question here. It is a case of hanging. Okay. So one eye is closed and other eye is open on the same side of the knot. This is asked in FMGE exam. So one eye is closed, one eye is open. There is a dribbling of saliva. What is this finding known as? Let's see who is going to answer. Yogesh Kumar, Arindam. Yes, Arindam Munna. So what is this finding that is seen in case of hanging? This can be asked in upcoming exam. So one eye is open and the pupil is more dilated on the same side of the knot because of compression over cervical sympathetic chain. What is this finding known as? So this is known as lay faces sympathetic. Okay, my dear student. So this is lay faces sympathetic. So this can be asked in your exam. Next question. Yeah. Question number 3. A 42-year-old male patient brought to casualty for unknown poison. At the time of presentation, patient was unconscious. On examination, it was seen that there were scratches on the upper limb. So there were scratch mark. Remember this question asked in FMGE 2021. So there was scratch mark over the upper limb. He had a increased blood pressure. increase blood pressure, and increase heart rate. Which of the following poisoning can be expected? So here the clue is increase blood pressure, increase heart rate, and there are scratch marks are there. And there are scratch marks. So what is the answer for this question? Scratch mark, remember, so that is because of formication. So formication or tactile hallucination. So all this go in favor of cocaine poison. Okay. The answer for this question is cocaine poison is the correct answer. So in cocaine poison, cocaine is a deliriant. In cocaine poison, you will see the tactile hallucination. That is known as formication. That is known as formication. The patient feels that so insects are crawling under his skin and there will be scratch mark over the body. So answer for this question is cocaine is the correct answer. The cocaine is a deliriant which act on the central nervous system. It inhibits the reuptake of norepinephrine, epinephrine, dopamine, serotonin from the brain. So that leads to increased levels of catecholamines. That leads to increased heart rate and increase BP. There can be cerebral hemorrhage and death, and anything that can be possible in case of cocaine poison. So LSD. In case of LSD also same signs and symptoms are seen, but the scratch mark will not be there. The scratch mark present only in case of cocaine poison, not in case of LSD. Cannabis. Remember cannabis, the preparations of cannabis, it can be bhang, it can be ganja, it can be hashish. So in cannabis, you will see run amok, which is an impulse disorder characterized by homicidal mania. So it is not cannabis. Heroin. So what are the signs and symptoms in heroin? In case of heroin poison, you will see respiratory depression, you will see meiosis, and you will see the euphoria and other signs and symptoms. So answer for this question is cocaine is the correct answer. Let's discuss about cocaine. Okay, let's discuss about cocaine. Yeah, cocaine, it is also known as white lady. It is a well-known deliriant. What do you mean by delirium? Delirium means disturbed consciousness. So in case of cocaine poison, what are the signs and symptoms? Increased blood pressure, pupil dilation. Remember this is pupil dilation. Pupil is constricted in opium poison, OP poison, barbiturate poison. Pupil is constricted. In case of cocaine poison, the pupil is dilated. So that can be asked in your exam. What about in datura poison? In datura poison, also the pupil is dilated. So blood vessels undergo constriction. There can be increased blood pressure. There can be increased heart rate, risk of cardiac arrest. So there can be intracerebral hemorrhage also because of increased blood pressure. Risk of respiratory arrest, tremors, all these are the signs and symptoms of taking cocaine. So what are the roots of taking? What is the roots of drug abuse of cocaine? Your answer should be snorting. Snorting is a one root. The second one is skin popping. Skin popping. So there can be two methods, snorting and skin popping. It is also known as white lady. So cocaine is also known as white lady. Yes, here is the case. Here is the case of body packer syndrome. So here is the case of cocaine toxicity. So the criminals, those who transport cocaine from one country to other country, so they will pack the cocaine in small plastic covers and they will consume it. Sometimes what happens, one of the cocaine pack which opens in the intestinal tract, that can reach to increased levels of cocaine in the blood, that leads to high blood pressure, intracerebral hemorrhage and death. So this is the case of body packer syndrome. Body Packer's syndrome. This is also asked in your exam. Body Packer's syndrome. You can see the colon, and in the colon you can see the multiple pockets of cocaine inside it. So this is a body packer syndrome. The cause of death was cerebral hemorrhage in this case. Okay, so that is about the cocaine. So look at this. As we discussed in classes, chronic cocaine poison that can lead to a condition known as tactile hallucination. Tactile hallucination is also known as Magnan symptom. It is also known as formication. It is also known as egg bomb syndrome. And in case of cocaine poison, you will see the scratch mark over the body because of the Magnan symptom. That is very, very commonly asked in your exam. Magnan symptom. Magnan symptom is seen in, your answer should be cocaine poison is the correct answer. Run amok is seen in, your answer should be cannabis is the correct answer. Dilated pupil, that is seen in case of datura poison. Constricted pupil, opium poison. So all this can be asked in your exam. Yes, hold my serotonin. Yes, you are right, Yogesh Kumar. Fine. Next is the fourth question. My dear students, this is the fourth question about the postmortem staining. Postmortem staining, rigor mortis, all these are very commonly asked in the exam. Here is the question. Cherry red postmortem staining can be seen which of the following poisoning? This is a very, very simple. Cherry red color. What is the answer? Can you try this? What is the answer, my dear students? My dear student, what is the answer? Yes, come on. Yes, you are right. So this is carbon monoxide poison is the correct answer. Carbon monoxide poison, you will see the cherry red color. That is true. What is the color in cyanide poison? Anyone, can you guess? Anyone, what is the color in cyanide poison? Because this is very commonly asked, that's why I'm discussing slowly. In case of cyanide poison, you know cyanide is an ideal suicidal. It can be used in murder also. So what is the color of postmortem staining in cyanide poison? In cyanide poison, it will be bright red color. The color bright red in color. So what is the color in hydrogen sulfide? What is the color in hydrogen sulfide? Hydrogen sulfide, it is also known as drainage gas, sewer gas. So that can lead to hypoxia, especially histotoxic hypoxia and sudden death. What is the color in case of hydrogen sulfide? Drainage gas. So it is used in Japanese detergent technique of suicide. My question is, what is the postmortem staining color in case of hydrogen sulfide? Your answer should be green color, correct? The color green color is the correct answer in case of hydrogen sulfide. Nitrates. So nitrates, what is the color? Nitrates, it will be reddish brown color. Some books gives chocolate brown color also. Okay, so both are correct answer. Reddish brown and chocolate brown color, that is seen in case of nitrates, aniline. So in all this condition, it can be chocolate brown or reddish brown. Carbon monoxide inhibits electron transport chain. It causes histotopic hypoxia, cherry red discoloration. Okay. Yes, my dear students. Okay. Good. Hold my serotonin. Vinish Kumar and Rahul beta, very good. All are answering. Arindam Manna, very good beta, Arindam. Now look at this. My question, my dear student, there is a finding. So I am in the postmortem room now. On looking at the dead body, I can see there is a collection of blood in the dependent area, that is postmortem staining. My question, my dear student, So is it normal or is there any poisoning in this case? Poisoning in this case. Come on, try. Who will answer this question? Who will answer this question? You can see here, this is the normal postmortem staining. You can see the purplish red color. So what is normal? So normal is purple color. Normal is purple or purplish red in color. This is normal. And you can see here there is a one more question asked in the exam. What about the margins of postmortem staining, where they are clearly visible or they are not distinct? Remember, the margins are distinct. In any case of postmortem staining, the margins are distinct. Look at this. Margins are distinct. Margins are distinct. In case of bruise, the margins are non-distinct. They are not clearly visible. So that is in case of bruise. But in case of postmortem staining, the margins are clearly visible. And you can see here, this is contact flattening. This can be asked in your exam. Contact flattening. What is contact flattening? Remember, contact flattening in case of dead body in autopsy, when some area, when it is compressed, in compressed area you will see no postmortem staining. So that is known as contact flattening. And this is normal postmortem staining. Now one more question can be asked in the exam. Fixation. When this postmortem staining is going to fix? Anyone, can you guess? Fixation. When it is going to fix? The fixation means when you apply pressure, when you apply some pressure over the dead body, there won't be no blanching. When there is no blanching, then it is known as fixed postmortem staining. My question, my dear student, after how many hours after death there is a fixation of postmortem staining? Anyone, can you guess? Anyone? Yes, hold my serotonin beta. Very good. Serotonin beta fixation that occurs in 6 to 12 hours. 6 to 12 hours, this can be asked in your exam. In 6 to 12 hours, the postmortem staining undergo fixation. Fixation means RBCs from the blood vessel, they enter into the tissues. There won't be no blanching at all. That is known as fixation, my dear students. So when it is fixed, then it is more than 6 hours. So that is the entrance point that can be asked in your FMGE exam. So now briefly, now we'll discuss some points about the postmortem staining. The postmortem staining is also known as vivices, is also known as suggulations, lucidity, cogitation, darkening of death. All are true. This is asked in one of the exam. What are the other names of postmortem staining? That is darkening of death, lucidity, and all other names. Anyone? What is the other name of cadaveric spasm? Anyone, can you guess? What is the other name of cadaveric spasm? Yes, come on, beta. Yes, you are right. 6 to 12 hours, you are right. Anyone? What is the another name of cadaveric spasm? You know, cadaveric spasm in drowning. Mud, aquatic matter in the hand in case of drowning is a feature of cadaveric spasm, antemortem drowning. My question is, what is the other name of cadaveric spasm? Anyone, can you guess? Very good. Hold my serotonin, you are right. Cataleptic rigidity. Very good. So some student answered cataleptic rigidity. My dear students, I'll discuss some more points here, there. Cadaveric spasm. Cadaveric spasm. This can be asked in exam. Cadaveric spasm is antemortem. Antemortem means the person was alive at the time of death. Okay, especially in case of drowning. So, yes. Next. Begins in. Now, come back to the postmortem staining. The postmortem staining begins in 30 minutes to 2 hours. So when a person dies, within 30 minutes, the blood will collect in the dependent area. So that is the postmortem staining. Establish in 4 to 6 hours. Establish everywhere in the every part of the body, especially dependent area, that is in 4 to 6 hours. The question asks fixation 6 to 12 hours. What do you mean by fixation? RBCs from the blood vessels enter into the tissues, no blanching occurs. Color is also very important. You must be knowing one very famous case in Kerala. It was murder, a case of serial murder, which was identified with the help of color of postmortem staining. Okay, cyanide murder case in Kerala. Okay, so cherry red color. What is the answer for cherry red color? Your answer should be carbon monoxide. Very commonly asked. Black color. Anyone can you guess? Black, where it is seen? Black. Yes, black. Anyone can you guess? Black postmortem staining is seen in black postmortem staining, that is seen in case of opiates. This can be asked in the exam. Opiates. Opium poison, morphine poison, heroin poison. You will see the black tongue, black postmortem staining. Okay. Next. Deep blue color. Deep blue color in case of carbon dioxide poison. In case of carbon dioxide poison, it is deep blue in color. Bright red in color, cyanide poison. Cyanide poison. Like example, cyanide Malika case, cyanide Mohan Kumar case. Okay, so in all these cases, cyanide poison, you will see the bright red color. Dark brown. Yes, my dear student, dark brown color. Yes, Lokesh beta, dark brown beta, Lokesh, Yogesh Kumar beta, Yogesh Kumar, Medico Rahul, dark brown yellow color, yellow, dirty fellow. Where it is seen? Anyone can you guess? Anyone can you guess where it is dark brown in color? Your answer should be, we discussed already, yellow color, that is seen in case of yellow phosphorus. Yellow phosphorus. Okay, so I said it is the dirty fellow. Why? Because there is a syndrome known as smoking stool syndrome. The smoking stool syndrome is caused by yellow phosphorus. Stool, smoking stool syndrome. Let me write here. It is known as yes. What is yes? Smoking stool syndrome, asked in your exam. That is caused by yellow phosphorus. Yellow phosphorus, also known as white phosphorus. Red phosphorus is non-poisonous. Next. Bluish green color. Hydrogen sulfide. Japanese detergent technique of suicide, drainage gas. Pink color. The pink color that is seen in case of hypothermia. In case of hypothermia, so there can be pink postmortem hypostasis. Chocolate brown color or reddish brown in color, your answer should be, that is aniline, nitrates, nitrobenzene. In all this condition, it is reddish brown or chocolate brown in color. So my dear students, in some cases, so the postmortem staining can be absent. Postmortem staining is absent in some cases. Can you name one condition in which there is no postmortem staining? Anyone can you guess? Let's make it interactive. Lokesh beta, serotonin, Mr. Rahul, Yogesh, Swapneshri, beta, yes, anyone, beta, answer kar do, answer my question, beta. Condition where there is no postmortem staining at all. Yes, come on. Right. Yes, come on. You are a forensic detective now. Come on. Yes, very good answer. Running water. Very good. So when death occurs in a running water, what happens in running water? So body will be changing its position like this. Running water or moving water, there will be continuous change of the body posture. So in that condition, there won't be no postmortem staining. And one more condition, severe anemia, severe hemorrhage, there can be no postmortem staining. Okay, all these are very important, very important. The case which I discussed, that is the Jolly murder case, it happened in Kerala, where 4 or 5 people were killed by giving cyanide mixed with the food and drink. Cyanide Jolly murder case in Kerala. Whenever you're free, type in Wikipedia, you'll get the details of the case. Jolly murder case. Yes. Now, anyone, my dear students, let me ask one more question. Rigor mortis is absent in. Can you guess, my dear student? Rigor mortis is absent in some condition. In what condition rigor mortis is absent? Anyone? Anyone? Yes, yes. Come on, come on, come on, come on. Okay. Yes, come on. Rigor mortis is absent in. Anyone? If you answer, you'll get chocolate from me. Okay. Rigor mortis is absent in. Yes, beta YouTuber. Okay. Yes, my dear student. Serotonin beta. Very good, beta. Very good. Yes, you are right. So, in case of fetus less than 7 months, in fetus less than 7 months, there is no rigor mortis, because when fetus less than 7 months, there is no actin and myosin, there is no proper development of the muscle, there won't be any rigor mortis. And also remember, normal rigor mortis will not develop after embalming. Remember this point, this can be asked in the exam. Embalming is also one more cause. Okay, next. Next, question number 5. A 36-year-old patient was presented to casualty due to poisoning some unknown seed or drug. There is an unknown seed or unknown drug. So, a patient is having dilated pupil and dry mouth. So, what I got here, dilated pupil and dry mouth. My dear student, dilated pupil. In forensic medicine, dilated pupil means datura poison. Dilated pupil and dry mouth, 9D manifestation. So the question is asked about the datura. So what is the answer? Answer is datura poison, correct answer. Very good. Lokesh KB, you are right. Datura poison, correct answer. Ganja, no. Ganja, the signs and symptoms are different. So in ganja, or in case of cannabis poison, you will see other signs and symptoms. There can be CPC, not this dilated pupil. LSD, no. LSD, already we discussed about that. Heroin, you will see the respiratory depression, meiotic pupil and all. So answer for this question is datura, correct answer. Now let's start with the datura. My dear student, examiner, especially in NEET PG, FMGE exam, examiners nowadays they asking question about the datura. Datura, datura, datura. My dear student, what is this? What is this visible in the picture? Can you identify what is this? What is this? Is this Ricinus communis? Is this castor plant or it is a datura plant? What is this, my dear student? Come on, come on, come on, my dear student. Yes, Indrajit Mandal, Satyam Pandey. Come on. So this is datura, datura plant. Datura plant. What is another name of datura plant? Yes, you are right. Thorn apple. Thorn apple. Thorn apple. Okay, thorn apple is the correct answer. What is the active principle asked in FMG exam? What is the active principle? Anyone can you guess? What is there inside it? What is that? It is known as road poison, railway poison. So it causes delirium, confused state, disorientation. What is active principle? So remember, active principle is hyoscine. So hyoscine is the correct answer. So not only hyoscine, it can contain, so hyoscine, hyoscyamine, and traces of atropine. So basically, what happens? There are signs and symptoms of atropine poison. So there can be signs and symptoms of atropine poison. So datura seed, the fatal dosage is around 100 seeds. So what is the fatal dosage? The fatal dosage is 75 to 100 seeds. 100 seeds is the fatal dosage. Okay. So what is the fatal period? Fatal period around 24 hours. 24 hours. What is the medical legal importance? It is used as a road poison. It is used as a railway poison. It is mixed with the food. It mixed with the food and given to the given to the people for the purpose of robbery, for the purpose of kidnapping, because it causes disorientation of the person. Okay, let's discuss about what are the signs and symptoms. Signs and symptoms can be remembered with the help of mnemonic 9D manifestation. 9D manifestation. Every manifestation starts with the D. 9D manifestation. What is D for? Dysphagia. Why dysphagia? Again, because of the increased levels of the hyoscine. So, action similar to atropine. Atropine blocks the acetylcholine. So, that leads to dysphagia, difficulty in drinking, difficulty in having food. Dysphagia होगा. और क्या होगा? Dysarthria होगा. मतलब patient is having difficulty in talking. Difficulty in talking. Dilatation of blood vessel. So dilatation of blood vessel looks red. Okay, red as a beet. Red as a beet. Dilatation of blood vessel. Diplopia. Diplopia. So there can be double vision. There can be distension of the bladder. All this because of the effect of atropine. So atropine fever and all, atropine signs and symptoms in pharmacology. Yes, dry hot skin. So patient will be having dry hot skin and the fever, that is because of stimulation of heat center present in the brain. So there can be dry hot skin. Next, drunken gait. The patient will be having drunken gait. So he will be having visual hallucination and auditory hallucination, and there can be drunken gait. So it can be mistaken with the drunkenness, that is ethyl alcohol. Delirium. The patient will be having irrelevant talking. Patient will be having muttering delirium. He will be doing muttering delirium, and patient will be doing like this. He will be pulling the threads like this. He will be doing. What is this known as? So this is known as carpologia. Carpologia is a tactile hallucination that is seen in case of datura poisoning. Carpologia. So that can be asked in the exam. So my dear student, yes, drowsiness, that can be seen. Dryness of the mouth. Then treatment. What is the treatment? The treatment is the standard traditional treatment. You can start with the emetics. You can give emetics. You can do the gastric lavas with the activated charcoal. Activated charcoal. Gastric lavas can be done in case of datura poison with activated charcoal. My dear students, what is the contraindication for gastric lavas? Anyone can you guess? What is the contraindication for gastric lavas, my dear students? Yes, come on. Yes, come on, my dear students. Gastric lavas. Gastric lavas is contraindicated in dash condition. Yes, my dear students. Serotonin, Lokesh. Yes, come on. Serotonin, Lokesh. Satyam Pandey. Yes, corrosive poison, except I wanted the answer, complete answer. Gastric lavas, you are right. Gastric lavas is contraindicated in corrosive, you are right. Except remember carbolic acid. So corrosive poison. I'll write here corrosive. Corrosive can be acid. It can be alkali. But except carbolic acid. So this is the point asked in your FMGE exam. Carbolic acid. Carbolic acid, nothing but your phenol, Dettol, Lysol, all this nothing but your phenol carbolic acid. So correct answer is carbolic acid. And what is the drug of choice in case of datura poison? The drug of choice is your physostigmine. The drug of choice is physostigmine is the correct answer. Remember, it is physostigmine. It is not neostigmine. Physostigmine can cross blood-brain barrier. It can reverse the signs and symptoms of hyoscine, hyoscyamine, and atropine. Your answer should be physostigmine, correct answer. Okay, not the neostigmine. And you can give pilocarpine also. My dear student, what about hemodialysis? It is asked in one of the FMG exam. Whether hemodialysis, is it useful in case of datura poisoning or not? Yes, yes, come on, Lokesh, better Lokesh, serotonin, come on, my dear student. My question is, so yes, can you answer this question? Hemodialysis, is it useful in datura poison? Yes, come on, yes, come on. Hemodialysis, remember atropine, lipid soluble. So in lipid soluble poison, hemodialysis is not useful. So using that funda, it is not useful. So hemodialysis is not useful in case of the datura poison that can be asked in your exam. Next. Next is about the question number 6. Yes, yes. Sixth question. Come back to 6. My dear student, are you enjoying the class? My dear student, is it okay? My speed, is it okay? The presentation, is it okay, my dear student? Are you getting my point, my dear student? Is it interesting? Yes, yes, come on, Bishal, Lokesh. Yes, Bishal, Lokesh. Better just replay me in the chat box so you can interact with me. You can keep me awake and you can keep yourself awake in forensic class. Yes, my dear students. Yes, come on, come on, come on. Yes, yes, yes. Come on, come on. Yeah, yeah. So next question. A farmer presents to emergency with a history of unknown poisoning. Patient is having pinpoint pupil. So pinpoint pupil and yes, Lokesh KB beta, very good. Sweating. Patient is having sweating. Increased secretions. Kerosene like smell. So kerosene like smell. Beta, very good. So whenever question, in exam this question was asked, kerosene like smell. Option was kerosene. In that exam, one of the option was kerosene. Many of the student they mark kerosene only. But remember, it is a kerosene like smell is seen in case of. Kerosene like smell can be seen in different condition, not only in kerosene, even in case of OP poison it can be seen. So this is the classical case of OP poison. This is the classical case of OP poison. This is very simple. In OP poison, you will be having pinpoint pupil, you will be having sweating, you will be having diarrhea, so many things. Mnemonic is sludge, MTF. So S for salivation, lacrimation, urination, diarrhea, gastric upset, emesis, pinpoint pupil. That is OP poison. So here, this is the case of OP poison. Your answer should be atropine, correct answer. So drug of choice is atropine, correct answer, no doubt in that. So this is malathion. So malathion is a alkyl phosphate. It comes under organophosphorus compound. Remember, organophosphorus compound classified into alkyl phosphate and aryl phosphate. Malathion is a alkyl phosphate. Parathion is a aryl phosphate. And remember, they inhibit an enzyme known as acetylcholine esterase enzyme irreversibly that leads to signs and symptoms of sludge discussed already. The answer for this question is yeah, yeah, I'm taking class. Okay, yeah, okay. So my dear student, what is the answer? Answer is atropine is the correct answer. Yeah, fine. Oximes, why not oximes? Anybody? Why not oximes? Why not oximes? So remember, atropine, I think it is better than oxime is the correct answer because oxime also can be given an OP poison. Example, prolidoxime, diacetyl monoxime, that also can be given in OP poison. But remember, drug of choice is still atropine only. Okay, physostigmine, not the answer. Acetylcysteine is given in paracetamol poison, N-acetylcysteine. Your answer should be that is atropine, correct answer. So first atropine, then oxime, then diazepam. So this is what we teach in forensic medicine. Yes, let's start with the. Now look at this, my dear student. We discussed about kerosene like smell. My dear student, in which condition you will see garlic smell in forensic medicine? Yes, come on, my dear students. In which condition you will see garlic smell? So OP poison, beta, anyway, you are going to learn in pharmacology and also in medicine. That's why I haven't discussed much about OP poison. Let's discuss some forensic topics. In which condition during postmortem you will get a smell of garlic smell? Anyone can you guess garlic smell? Yes, beta, you are right. Serotonin, naru gas also there will be findings of OP poison. Both are asphyxiants only. So OP poison is also asphyxiant. Naru gas is also asphyxiant. So yes, you are right. Arsenic poison, very good. Anyone other than that? Arsenic, you are right. One more poison in which you will see the garlic smell. Your answer should be yellow phosphorus. Okay, in yellow phosphorus also you will see the garlic smell. Garlic smell. The question can be asked in your exam. Burnt rope smell. Burnt rope smell. Which condition it is seen? Burnt rope. Can you guess? Burnt rope smell. Where which is it? Fishy smell. Fishy smell. Okay. Rotten egg smell. Rotten egg smell. Acrid smell. Anyone can you guess? Anyone can you guess this, beta? Yes, come on. Yes. Burnt rope. Burnt rope. Where it is seen? I'm giving you clue, my dear student. Burnt rope. Burnt rope is seen in. Yes, come on. Yes, burnt rope is seen in cannabis. You are right. Very good. Rotten egg. Rotten egg smell. Fishy smell. Yes, rotten egg. Hydrogen sulfide. Fishy smell. Zinc phosphide. Acrid. Paraldehyde smell. In case of paraldehyde poison, you will see the acrid smell. So, okay, burnt rope in case of cannabis. What are preparations of cannabis? Ganja. Charas. Hookah. We call it as hookah. Hookah, that is nothing but ganja. Charas, hashish, bhang, hashish oil, mazoon. All is a preparations of cannabis. So that we'll discuss tomorrow about that. Okay. Yes. Good answer. Good. Now we are into the seventh question, my dear student. The question again is about the asphyxia. Look at this. In FMGE exam, they're asking question about FMGE, that is asphyxial death. Hanging, strangulation, smothering, suffocation, all are important topics. So whenever you're free, just go through the videos of our classes. So they are very, very important. Question is about judicial hanging. In judicial hanging is a method of execution of condemned criminals. In such cases, the cause of death can be. So what is the answer, my dear student? Judicial hanging. In judicial hanging, remember, submental position is used. The most effective position is submental position. The knot is placed over the submental position. So what is the answer, my dear student? So in judicial hanging, cerebral hypoxia, yes, it can be. Asphyxia also it can be. Cervical vertebra fracture also. Vagal inhibition also. But here, what is the best answer? According to Case and Reddy, it is the cervical vertebra fracture. So in judicial hanging, so there is a fracture of C2, C3, C4. When there is a fracture of C2, C3, C4, there is separation of brain stem from underlying spinal cord that leads to sudden death. Okay. And the position that is used and the fracture that is known as hangman fracture. My dear student, hangman fracture. Yaad rakhna, hangman fracture is seen in case of judicial hanging, that is the fracture of C2. Bilateral fracture, okay, bilateral pars intra-articularis fracture of the C2. Now, anyone, undertaker fracture. Anyone can you guess what is undertaker fracture? Yes, my dear student. So answer for this question is C. Okay, no doubt it is C. Yes, undertaker fracture. Okay, anyone can you guess what is undertaker fracture? Let's see now. Undertaker beta WWF. Undertaker fracture. Yes, my dear student, come on. Hold my serotonin. Lokesh, Akash, beta undertaker fracture क्या होती है बताओ? I'm waiting, my dear student. Can you answer? Akash, Yes, Bishal Devanath. Yes, yes, very good. Serotonin undertaker fracture is the fracture of C7 fracture or C6 C7 fracture, that is known as undertaker fracture. When neck is unsupported during transport of dead body, there can be fracture of C7, that is known as undertaker fracture, which is a well-known post-mortem artifact. Okay, post-mortem artifact. Yes. Now look at this. So this is the autopsy. So when I was examining case of case of hanging, especially judicial hanging, so you will see a fracture of C2, C3, C4. So this is the fracture of C2, C3, and C4. Okay. And what is the knot position? The knot position, remember, it is submental position. So this can be asked in your exam. What is the preferred position of knot in judicial hanging? Your answer should be submental position. But in India, either it is on the left jaw or angle of the right jaw. Also, it is also possible. Preferred is submental position, which causes death within 5 to 10 minutes. It usually causes immediate death. Heart will stop after 5 to 10 minutes. So, my dear student, look at this. Now, here is a case of judicial hanging. I can see the carotid artery. I can see the carotid artery. Carotid artery. Carotid artery. In carotid artery. So what I can see the transverse tear. I can see the transverse tear. What is this known as? This is asked in your FMG exam. Transverse tear. Transverse tear at the carotid artery seen in judicial hanging. What is that known as? Anyone? Lokesh, Bishal, serotonin. Yes, Akash, beta. Anyone? Can you guess? Transverse tear in carotid artery, especially involving the intima of the blood vessel, that is known as Amsuth sign. So this can be asked in your exam. What is this known as? Amsuth sign. Amsuth sign is the correct answer. This is an extra edge point, remember. So I think this is okay. Now question number 8. According to Indian Constitution, the age limit for imprisonment in the juvenile home. So in juvenile home. Okay. So I think the question is about juvenile. What do you mean by juvenile in India? So male or female, what do you mean by juvenile? Anyone, can you guess? Male or female, what do you mean by juvenile? Yes, anyone, can you guess? 16, 15, 18, 22. Yes, come on, my dear students. In Nirbhaya case, so one of the offender was juvenile and he got 3 years of imprisonment. The question is about what do you mean by juvenile in Indian Penal Code, or what do you mean by juvenile in Juvenile Justice Act? Anyone, can you guess? Anyone? Yes, Bishal, beta, male also 18, female also 18. Female also 18. The maximum punishment is 3 years. So maximum punishment is 3 years. But now recently an update, remember, except in case of heinous crime. Except in case of heinous crime. Like example, murder is a heinous crime. Rape, heinous crime. Rape and murder, heinous crime. In heinous crime, even a juvenile between age 16 to 18 can be punishable like an adult. So that is according to recent update in Juvenile Justice Act. Okay, Juvenile Justice Act, that is decided by Juvenile Justice Board. So except in heinous crimes. So please remember this. So this can be asked in the exam. So in heinous crime, what do you mean by heinous crime? The heinous means applicable between 16 to 18 years. What do you mean by heinous crime? Heinous crime means any offense which has imprisonment more than 7 years. Any offense which has imprisonment more than 7 years. Like example, murder. What is the punishment in murder? Life imprisonment or death sentence. Attempt to murder, 10 years of imprisonment. Rape, life imprisonment, any offense which has a imprisonment more than 7 years is known as heinous crime. If juvenile involved in heinous crime, punishment can be like adults also. This can be asked in your upcoming exam. Answer for this question is 18 correct answer. Okay, 18 correct answer. Good. Now look at this question number 9. Question number 9. A person met with an accident. So person met with an accident, probably road traffic accident. So probably road traffic accident, and he was taken into the hospital. He was not accompanied by any of his relatives or friends. So nobody is there to give consent for the surgery. Doctor has to suggest him for emergency surgery in good faith. Okay, emergency surgery in good faith. According to ethics, what should be done? Option A, doctor can do surgery in case of emergency, has to wait for getting consent from his relatives, has to wait for the consent of the hospital administration, has to get consent from the police station. What do you think, all of you? So patient is having, serious illness. Maybe he is having, I think he is having, extradural hemorrhage. Extradural hemorrhage, it is a life, it can lead to death if surgery is not done in time. It causes compression effect and complications and death. So my question here, whether the doctor can do surgery without consent or not. What is the answer, all of you? Has to police station? No. Hospital administration? No. Relatives? No. Answer is doctor can do surgery. So you can do surgery in good faith. In emergency, who will give the consent? The consent is given by law. The consent is given by the law. That is nothing but 92 IPC. 92 IPC. So please remember, my dear student, this can be asked in your exam. Surgery during emergency without consent in good faith can be conducted under dash IPC, 92 IPC. That is good faith without consent. Anyone? Good faith with consent. What is the IPC? Anyone? Good faith with consent. What is the IPC? Anyone? Can you guess? Come on, my dear students. Come on. Yogesh Kumar, Dr. Yogesh Kumar, Dr. Kishore Kumar, Dr. Lokesh, Bishal. Surgery in good faith with the consent from the relative or consent from the patient. What is that IPC for that? IPC for that? Anyone? One who answer will get 3D chocolate from me. 3D chocolate from me. Come on. Yes, it is nothing but 88 IPC. So 88 IPC. This is IPC. It will give immunity to the doctors. It gives some immunity against medical negligence. If the question asked in exam, the immunity provided by some IPC to prevent you from the medical negligence, your answer should be 88 IPC. Okay, 88 and 92 both can be asked in your exam. One more asked in the exam, 84 IPC. What is 84 IPC? Very commonly asked in your exam, 84 IPC. It is known as, what is that? Anyone? I'm just waiting for your answer. 84 IPC. Beta, all of you, my dear student, Kishore Kumar, Salini. Yes, come on, beta. Salini. What is 84 IPC? 84 IPC. I'm giving you, some story. McNaughton rule. McNaughton was a person suffering from delusion of persecution. He committed murder. The court decided that it is not a punishable offense. What is that IPC known as? Anyone, can you guess? 84 IPC also known as McNaughton's rule. Yes, McNaughton's rule. This can be asked in the exam. Yes, serotonin, you are right. It is the criminal responsibility of insane person. Criminal responsibility of insane person given by section 84 IPC. Okay, so that is what asked in your exam. McNaughton's rule Durham's rule, Curran's rule, American Law Institute test, irresistible impulse test. All this can be asked in your exam whenever if we go through the rules of insanity. He is McNaughton. Okay, remember the name McNaughton. McNaughton was the person suffering from delusion of persecution. Under the influence of delusion, he committed the offense known as murder. Court decided that it is not a case of murder because the offense was committed under the influence of delusion. It is also known as right and wrong test. Okay, yes. Next, question number 10. Which of the following is correct in the case of death due to starvation? My dear students, look at this. Can answer this? Can answer this question, my dear students? Starvation. So this is a case of chronic starvation. Okay, chronic starvation. Chronic starvation. Which of the following is true? Option A, expanded lungs, enlarged heart, large stomach, distended gallbladder. What is the answer? Come on, count, try, my dear student. So one question matters a lot in FMG exam. So 150 should be the score, right? To pass the exam. So yes, come on. So the expanded lungs. So what happens to the lungs? No, lungs in case of starvation, they are shrunk. Okay, shrunken. Enlarged heart, no. In case of starvation, you will see brown atrophy of the heart. Large stomach, no. What is the answer? Distended gallbladder. Distended gallbladder is the correct answer. So distended gallbladder, so that is the correct answer. Very simple question. Now let me ask one more question here. In acute starvation, in how many days the person is going to die? In acute starvation, when food is not there, no food, no water. Okay, no food, no water. In how many days the person is going to die? Yes, my dear student, can you guess? Yogesh Kumar. So in acute starvation, when there is no food, there is no rice, there is no sambar, there is no idli vada, there is no roti curry. So no water only, no food, no water. In how many days the person is going to die? This can be asked in your exam, especially forensic medicine. Can I guess? Yes. So he is going to die in 2 weeks. According to standard textbook, 10 to 12 days. 10 to 12 days. Okay. When only water is there, a person can be survived. He can survive for about 50 to 60 days. 50 to 60 days. So this can be asked in your exam. And there can be severe pain of hunger. So the hunger pain that can seen up to 2 days. Up to 2 days in case of starvation. So this is about the some MCQ. So food and water 10 to 12 days. Only water available 50 to 60 days. Hunger pain 48 hours. So starvation and death. So everyone has a right to right to live. Nobody has right to die. So what is the article that is actually related to this? Anyone can you guess? What is the article of Indian Constitution that is related to every person has a right to live, right to life? No one has right to die. So what is that article that is related to this starvation? Your answer should be Article 21. Okay, Article 21. This is also asked in your exam. Article 21. Okay, next. Starvation we discussed about. Next is the very important topic. My dear student, the question is about the fractures. So question is about the fractures. Gutter fracture is caused by. What is the answer? My dear student, can you try? Can you try this? Can you try? Come on. Yes. You must try. Yes, you may. Yes, come on. Yes. Yeah, come on. Yes. Bullet. See, gutter fracture means the fracture of the skull. We are talking about fracture of skull only in forensic medicine. Usually, it can be linear fracture, depressed fracture, gutter fracture, ring fracture, hinge fracture. All these are very commonly asked. So in this exam, gutter fracture was asked. Gutter fracture. What do you mean by gutter fracture? Gutter fracture means oblique bullet wound. Your answer should be, it is the bullet wound, correct answer. So it is the oblique bullet wound. Oblique bullet wound is the correct answer. So gutter fracture involves outer table. Normally it involves the outer table. So outer table is normally involved like this. So when bullet hits the skull at an angle, an oblique angle, so there can be involvement of the outer table. There can be a formation of gutter. So that is known as gutter fracture. Gutter fracture is caused by the firearm wound, especially the bullet wound. Okay, again gutter fracture can be three types: type 1, type 2 and type 3. Type 1 involves the outer table, type 2 involves the spongy bone, type 3 means through and through wound. So the most common one is the type 1 oblique bullet wound. That is correct answer. Blunt trauma? No. So blunt trauma, so that can lead to any other fracture, not the gutter fracture. Stone injury, the stone can lead to depressed fracture, not the answer. Fall from height. Anyone, my dear student, fall from height. What is the skull fracture that is seen? Fall from height. When fall from height, fall on buttocks, fall on feet, so there can be a fracture. So what is that fracture of the skull that is known as? Anyone, can you guess? So that is known as ring fracture. Ring fracture. Okay. Ring fracture is seen in case of fall from height. It is seen around the foramen magnum. Foramen magnum. Let's make it interactive. Now look at this, some image based question. Look at this. There is a fracture. What is this fracture known as? So my dear student, so this can be asked in your exam. So there is a fracture of the skull. There is a fracture of the skull, and you can see there is a fracture involving the temporal bone. Temporal bone, which is irregular in nature. Irregular in nature. My dear student, so it can be caused by road traffic accident. It can be caused by assault. It is the most common fracture. It has an irregular course. It involves only the outer table. It is difficult to recognize on X-ray. What is this fracture known as? Anyone? So this is not ring fracture. So this is known as linear fracture. Okay. Linear fracture is also known as fissure fracture. Fissure fracture. If they ask you an exam, most common skull fracture, your answer should be linear fracture. It can be caused by road traffic accident, or it can be caused by any blunt force trauma. And normally it is associated with EDH. EDH. Okay. So my dear student, what is the bleeding artery in EDH? What is the bleeding artery in EDH? Anyone, can you guess? Anyone? Yes, Vikas beta. EDH, extradural hemorrhage. What is the bleeding vessel? Yes, yes, come on. Bleeding vessel. This can be asked in exam. Yes, come on. Come on, come on, come on. Yes. EDH is because of bleeding from middle meningeal artery. Okay, middle meningeal artery, posterior branch. So the common site is the temporal bone. Pirion is the common site of linear fracture. Okay, and EDH is usually unilateral. Usually unilateral. Okay, good. Good answer. Good, beta. Shubham Sharma and Vikas Dhaka. So you answered very well. So you are right. It is middle meningeal artery. Correct answer. Very good. So, and remember EDH. So it can be mistaken with drunkenness. So it can be mistaken with drunkenness. So this can be asked in your exam. And second thing, remember, so this EDH, so there can be something known as lucid interval. Okay, this is also asked in exam, FMG exam. Lucid interval. So what do you mean by lucid interval? The lucid interval means the period of consciousness between the two periods of unconsciousness. That's very commonly seen in extradural hemorrhage. It can be seen in subdural hemorrhage also. What do you mean by lucid interval? Lucid interval means it is a period of consciousness between the two periods of unconsciousness. So, my dear student, in lucid interval, can person make valid will? Can person make valid will? Yes, come on. Anyone? Can he make valid will? So, can he make valid will? Yes, he can make valid will. Valid will. So, valid will, testamentary capacity, that is also asked in the exam. Second fracture. We are into the second fracture. Now, look at the second fracture. Come back to the skull fracture now. So, we'll discuss about the skull fracture. Yes, what is this fracture? There is a fracture involving the base of the skull. So, involving the base of the skull, the separation of anterior two-third from the posterior one-third, or the skull, base of the skull is divided into anterior half and the posterior half. It is commonly seen in motorcyclists in road traffic accident. What is this known as? Anyone can you guess? What is this known as? Yes, come on, come on, come on. Yes, come on, Shubham. So this is known as hinge fracture. Hinge fracture. Hinge fracture. So what do you mean by hinge fracture? Hinge fracture means motor cyclist fracture. There is a separation of anterior one-third from the posterior two-third. There can be again three types are there. The most common one is the type 1. Next, look at this. Look at this fracture. Fracture around the foramen magnum. So this is known as ring fracture. Ring fracture. The last one. Look at this last one. So last fracture. Look at this skull fracture. It is caused by hammer. Caused by hammer. So my dear students, fracture caused by some object which has, which is a heavyweight object, or which having small striking surface. Like example, hammer, which has a small striking surface but is heavyweight object. So what is that fracture known as? Anyone can you guess? Anyone can you guess what is this fracture known as? Depressed fracture. And depressed fracture. Depressed fracture is also known as signature fracture. This is again asked in your exam. Signature fracture. Okay. Signature fracture is also known as fracture illa signature. It is caused by hammer. Okay. There are 4 important questions, my dear student. One is the linear fracture, hinge fracture, ring fracture, depressed fracture. All these are very commonly asked. Gutter fracture caused by oblique bullet wound. So this is what very important. So my dear student, are you getting my point? Vikas, Shubham Sharma, Serotonin, Yogesh Kumar, Bishal Devanath. My dear student, are you getting my point? Are you getting my point? Is it okay, my dear student? Reply me in the group. Reply me in the chat box. So keep me, awake, and I'll get more energy from you, so I can teach you more effectively in next half an hour. Come on, come on, come on, my dear students. Come on. Yes. Yes, say yes in the group. Say yes in the group. Yes. Yes. Come on, come on, come on. Yes, Vikas, beta Vikas. Okay, Shubham. Yes, Shubham Sharma. Yes. Okay. Yes, come on. Now let's start with the sunrise. Yes, sir. Okay. Okay, good, fine. All are. Next is the topic number, that is the 12 of the day. Venom of the following snake. Venom of the following snake. Look at this. This snake. So options are given: neurotoxic, vascular toxic, myotoxic, and cardiotoxic. Look at this. What is the answer? So what is the answer, Kumar? So it has a hood. Yes or no? It has a hood. So whenever you see the hood, so it can be 2 types. It can be common cobra or it can be king cobra. Okay. Hood is there. So either it can be common cobra, or king cobra. King cobra. So both common cobra and king cobra, they are neurotoxic. They are neurotoxic. So answer is simple. The answer is neurotoxic, correct answer. So neurotoxic, correct answer. My dear student, how to differentiate between common cobra and king cobra physically? What is the physical feature that differentiate between common cobra and king cobra? Yes, come on. What is absent in king cobra? Anyone can you guess? Anyone can you guess? King cobra, what is not there? So king cobra, it is known as Ophiophagous Hanna. In king cobra, what is absent is the spectacle mark. Spectacle mark. Spectacle mark is absent. Okay, so that is king cobra. Common cobra known as Naza Naza. So that has a spectacle mark. So one very important finding is the spectacle mark, which is present in common cobra, absent in king cobra. So most of the neurotoxic snakes, so they act on neuromuscular junction. They can be presynaptic or postsynaptic. They cause inhibition of acetylcholine release, or they act on the neuromuscular junction, prevent the action of acetylcholine. One very important finding will be ptosis. Question can be asked in exam. What is the very important finding in neurotoxic snake bite? Your answer should be ptosis. So ptosis, respiratory paralysis, there can be broken neck sign, there can be nausea, vomiting, abnormally sleepy, drowsiness. All this can be seen in case of, so that is the neurotoxic snake bite. Okay, vascular toxic. So my dear student, can you name some snake which is vascular toxic? Vascular toxic. Vascular toxic. Vascular toxic, they act on the blood vessel. They act on the blood vessel. They increases clotting time. They increases bleeding time. They cause DIC. They cause DIC and they cause death. Death occurs in 3 to 4 days, either due to kidney failure or either due to DIC, septicemia and death. So vascular toxic, remember, they are vipers. 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 So vipers are vascular toxic. How to remember? V for viper, V for vascular toxic. Myotoxic. They are sea snakes. The sea snakes are myotoxic. Myotoxic. Yeah. Neurotoxic, they are known as Elapidae. Vascular toxic, they are known as Viperidae. And myotoxic, they are usually sea snakes. So next, now let me ask my dear student, what is one very important clinical test in case of viper bite? Can you guess? Anyone can answer? What is the, yes, common, my dear student, what is the very important bedside test that is very useful in diagnosis of viper bite? Yes, anyone? Rishabh Dubey, Sunrise, Vikas D. Yes, come on, Vikas D. Beta and Shubham Sharma. What is the important bedside test which I will do in the clinical, in the patient ward only? I can detect the case of viper bite. It's very simple. Anyone? Anyone? Let's see. Let's see who is going to answer. I'm giving you clue: increase clotting time, bleeding time. What is that test known as? Yes. Yes, you are right. It is 20 minutes whole blood clotting test. Okay. 20 minutes whole blood clotting bleeding time test. Okay. Clotting, whether there's a clotting or not, 20-minute whole blood clotting time test. So that is the test that is done in case of viper bite. Now, let me ask you some more question now. Now look at this, identify these two snakes. So just tell me what type of snake they are, whether they are vascular toxic or they are neurotoxic. So I'm giving you clue here. So which has a hood here, hood, spectacle mark is there, spectacle mark is there. Okay, what is this? What is this? And you can see here this, you can see the viper here. What is this viper known as? This viper which has a bird foot mark over the head, bird foot mark over the head, and you can see the white wavy line. White wavy line. So what is this A and what is this B? Yes, come on, my dear student. They comes under big four snakes in India. Okay. So one which has a bird foot mark, white wavy line. Your answer should be, so this is saw-scaled viper. Saw-scaled viper. And this is common cobra. Common cobra. Okay, common cobra. Saw-scaled viper and the common cobra. So A is vascular toxic. A is vascular toxic. And the B is neurotoxic. Neurotoxic. They are postsynaptic. Remember, it is a postsynaptic poison. It is a postsynaptic. Okay. Now, two more snakes. There are big four snakes in India. Okay. So one is the saw-scaled viper. Second one is the common cobra. Two more are there. Now look at this. C and D. Identify this. Yes, my dear student, interact with me. Interact with me so that you are going to learn in a better way. Now you can see here a snake which has a white transverse line. You can see the white transverse line, steel black in color, which is steel black in color, white transverse line is there. The fatal dosage is 3 to 6 milligram. 3 to 6 milligram can cause death in case of this snake. What about this? And look at this, which has a triangular head. Triangular head. And you can see the black or brown spots. You can see the black or brown spots over the body. Triangular head also you can see here. So triangular head. Constricted neck. So triangular head, constricted neck. What it is? Yes, come on. So, yes, you are right. So C is the common crate. Yes, you are right. C is the common crate. And D is the Russell's viper. Russell's viper. Okay. So there are big four snakes in India. What are they? Common cobra, common crate, Russell's viper, saw-scaled viper. Common cobra scientific name Naza naza. Common crate Bungaro ceruleus. Russell's viper Dubai russelli. Saw-scaled viper Achis carinatus. Among all the four snakes, the most fatal is the common crate. What is the fatal dosage? 3 to 6 milligram of dried venom. So what is the treatment? Polyvalent anti-snake venom. The treatment is polyvalent anti-snake venom that will treat all the four snake bite in India. Okay, so this is what you must know. So all of you understood this question, my dear students? The venom of the following snake is, your answer should be neurotoxic. Any doubt in this? Any doubt, my dear students? Any doubt you can ask me? Any doubt you can ask me? Come on. Yes. Okay. So most common symptom is ptosis. Okay. Common crate is presynaptic. Common cobra postsynaptic. All this can be asked in your exam. Any doubt in this, my dear students? Any doubt? Shall I move on? Say yes in the group. Question number 13. So the order in this condition. So there is a picture given to you, and the picture is the picture of mummification. So this is a case of mummification. Why mummification? Because you can see here facial features. The facial features are very clearly visible. So whenever in a dead body, when facial features are very clearly visible, then when the body weight, it is when it is more than 70% loss, when it is black or brown color, when it is stored in a dry atmosphere, dry high temperature atmosphere, it must be a case of mummification. Why mummification? In mummification, you will see the facial features very clearly. Like example, laughing mummy. Laughing mummy is a very famous mummy where you can clearly recognize the facial features. Like example, laughing, peeping, like that. So what is the question is, what is the order in this condition? ऑर्डर क्या होती है, स्मेल क्या होती है? पंजेंट होगा, फाउल स्मेल होगा, ऑर्डरलेस, offensive. What do you think of it? So it is dry, it occurs in dry environment, dry, hot, okay, no humidity. So all this, whenever it is dry, hot, no humidity, no bacteria. When there is no bacteria, so it becomes what? Odorless. So answer is odorless. Odorless. Okay. So what is the smell in case of adipocere formation? Anyone? Adipocere, what is the smell? Anyone can you guess? Adipocere dead body or saponified dead body. What is the smell? What is the smell? Yes, come on. Yes, come on. Rohit Hadke. Rohit, come on. So adipocere formation. So the smell will be fruity smell. Fruity smell, or you can see the sweety smell. Because of saponification, you will see the fruity smell. So next, and it is foul smell in case of decomposed body. In case of decomposed or in case of petrified dead body. So petrified dead body. So answer for this question is odorless is the correct answer. Answer is odorless is the correct answer for this question. So now look at this picture. My dear student, there are 3 pictures given to you. You need to identify what are these changes in, what are these type of late changes. Let me discuss about this. Come on, my dear students. Come on, look at this. There are 3 images given to you. In image number 1, there is a image, and image A, you can see the facial features clearly visible. Facial features are clearly visible. You can see the body position also clearly visible. What is this? And in B, you can see the white discoloration of the body commonly occurs in the fatty areas. In C, you can see there is a purging. You can see the marbling also. So what are these? Can I identify this? Very simple, all of you. Marbling also you can see here. So marbling, you can see here. This is marbling. So beta, what is this? Come on. Serotonin. So A is mummification. You are right. A is mummification. What is B? Adipocere formation. Adipocere. And the C is putrefaction. Putrefaction. All the 3 can be asked in your exam. The question asked in exam, skeletal features, they are clearly visible, or the facial features are clearly visible in case of mummification. Facial features are totally distorted in case of putrefaction. Adipocere, you will see the white discoloration. That is also known as saponification. Fatty acids combines with the calcium that forms calcium salt. That is known as saponification. Smell in case of mummification, odorless. Fruity smell in adipocere. Putrefaction, foul smelling. Mummification occur in hot, dry environment. Adipocere occurs in hot, humid environment. Putrefaction is normally normal is the most common late change in the dead body. Okay, all this can be asked in your exam. Yes, okay. So this is about the 3 important question that can be asked in your exam. Let me ask you one more question, my dear student. What is Casper dictum? What is Casper's dictum? Anyone? Anyone can answer? Casper's dictum. What is Casper's dictum? So this can be asked in your exam. What is Casper's dictum? Casper's dictum means rate of putrefaction in different media like air, water, and in earth. Rate of putrefaction in air, in water, in buried body. that is known as earth. So that is 1 is to 2 is to 8. So it is faster in air, it occurs in 1 day. It is little slower in water, occur in 2 days. It is more slower in case of buried body, that is around 8 days. So Casper dictum is 1 is to 2 is to 8. 1 is to 2 is to 8 is the Casper dictum that can be asked in your upcoming FMGE exam. Okay, 1 is to 2 is to 8. Fine. Now, this question number 14. A sample has been evaluated. Following observation is noted under the microscopy. Identify the test demonstrated. Yes, come on. Who can answer this? Who can answer this? Now, see what I discussed in the beginning. Blood stain, seminal stain, very commonly asked. The same year, the blood stain was also asked, seminal stain also asked. So you can see here brown color, brown rhombic crystals. So in the picture there is a brown rhombic crystal. So what is the correct answer? What is the correct answer for this question? Can it be Barberio test? Can it be Barberio test? No. In Barberio test, you will see yellow needle crystals. That is not the answer. Benzidine test. In Benzidine test, you will see the blue color. Benzidine is a screening test. You will see blue color only. There are no formation of hemine crystals. So it is not Benzidine. So either it is Tickman or it is Takayama. Either it can be Tickman. ये होगा Tickman होगा, नहीं तो Takayama होगा. What is the best answer? Brown rhombic crystals. Anyone can you guess what is the answer? Brown rhombic. I remember like this. Brown man. I remember brown man. I remember like this. Brown man and pink mama. I remember like this. It is very funny. Pink mama. Okay. Pink mama. So brown man means Tickman test. Man is there, no? Tickman test. Very funny. Man is there. Brown rhombic crystal. Takayama is there. I read it as a mama. Yama mama. Mama hoga pink mama. So it is pink feathery crystals. So pink feathery crystals, they are seen in case of Takayama test. Brown rhombic crystals, they are seen in case of Tickman test. The answer is Tickman test is the correct answer. Answer is B is the correct answer. Okay, my dear student. So remember the mnemonic, brown man, pink mama. So now let me start with the blood stain. Okay, let me start with the blood stain. So this is very, very commonly asked in the exam. Look at this. Here is the blood stain. Here is the blood stain. See, for me it is blood stain. So it can be anything. It can be beetroot stain also. It can be some fruit juice also. It can be some vegetable juice also. How to confirm that it is a blood stain? Blood stain is a very important evidence. So who knows whether it is a blood stain or it can be some other stain, where some beetroot stain also look like a blood stain. So how to confirm that it is a blood stain? We use a test known as screening test. It is a test known as screening test. The question can be asked in the exam, what is the mechanism of screening test? Remember, hemoglobin present in the RBC that has a peroxidase activity. Peroxidase activity. So hemoglobin present in the RBC, if it is a blood stain, it has a peroxidase activity. So when it combines with H2O2, it gives rise to some color. It gives rise to some color. So that is the principle of screening test. So hemoglobin has a peroxidase activity. Peroxidase activate on the H2O2, that will give you different colors. And different tests are there. Like example, benzidine test. My dear student, what is the color produced in benzidine test? Anyone can you guess? What is the color produced in benzidine test? Anyone? Come on. Anyone? Come on. Benzidine starts with the B. Benzidine, blue color. Benzidine, beta blue color. What is the color? Blue color. All is a screening test. Screening test, they have a very high sensitivity. Very high sensitivity, less specificity. So benzidine produces blue in color. Okay. So benzidine test is not used because it causes bladder cancer. Second test, phenolphthalein test. Phenolphthalein test, it produces pink color. Pink color. Phenolphthalein test is also known as KM test, Castle-Meyer test. So this can be asked in upcoming FMGE. Castle-Meyer test, it is the another name of phenolphthalein test, which will give you pink color, which is the most common test. So if they ask you an exam, most common test, phenolphthalein test. Benzidine test, outdated. Why? Bladder cancer. Next, TMB, tetramethylbenzidine. That also gives us to blue color. Blue color. Luminol test. Luminol test. You know, luminol test, it has a very good importance. It is used in old blood stain also. Old washed blood stain. Can be used in old washed blood stain. Like an example, in case of Nirbhaya case, Delhi crime, Nirbhaya case, the entire bus was washed. So in even in old washed blood stain, you can use luminol test. Okay, luminol test that can be asked in your exam. Licomalacid green test, which give you the color green color. There's one more test known as orthotolinine test. Orthotolinine test, which will give rise to blue color. So all the color also very important. Now comes is the confirmatory test. So what are the confirmatory tests in case of blood stain? There are two confirmatory tests. What are they? Takayama test, Ekman test. What are confirmatory test? Takayama test. So in Takayama test, you will see the brown crystals, brown rhombic crystals, like this. Sorry, in Takayama test, you will see the Yama. You know, Yama means mama. Mama matlab pink feathery crystals, right? We discussed about the pink feathery crystals like this. You will see the pink feathery crystals in Takayama. And in case of Ekman test, you will see the brown rhombic crystals. Brown rhombic crystals. Take example like this. Brown rhombic crystals. One more test is there, which is the most useful test. That is known as spectroscopic examination. Spectroscopic examination. If they ask you an exam, the most confirmatory test, your answer should be spectroscopic examination. What are two Hemin crystal test? Ekman test, Takayama test. What are the screening tests? Benzidine, phenolphthalein, tetramethylbenzidine, luminol, licomalacid green, orthotolinine. Which is the commonest test? KM test, nothing but phenolphthalein test. Okay, all these are very commonly asked in the exam. Look at this now. Now who is going to identify this? What is the test? Yes, come on, come on. Here is the crime scene, a case of murder. Here is a case of murder, and you can see the pink color. Identify this, my dear student. Come on, serotonin, Devanath. Yes, come on. Yes. Yes, come on. Yes, pink color. You can see the pink color. What is this test? So on applying some solution, what we got pink color of the reagent. What is that known as? Yes, come on, try this. What is this? Come on, try. Vishal Devanath, come on. So this is the KM test. KM test, also known as phenolphthalein test. Okay. Next, look at this test. Anyone can identify what is this test? Old washed blood stain. So old Washed blood stain. Old washed blood stain. Use a test known as luminol test. Luminol test. Luminol test. Now look at this. Brown. Brown rhombic crystals. Hickman test. Pink feathery crystals. That is Takayama test. So let me write here. So this is Hickman test. Hickman test. So this is Takayama test. Takayama test. Okay. Both can be asked as an image-based question in your exam. Very good. So Avanish, beta, Avanish, good answer. Avanish Yadav, beta, very good. Now look at this test. So this is how we do stains, blood test. Look at this. So blood stain which is taken, which is heated. Need to collect the blood stain at the center. At the center. Now it is prepared. Slide is prepared. So you need to add the glacial acetic acid along with NaCl reagent. So when you add, there will be formation of hemine crystals. So these hemine crystals can be either Takayama or Teichmann test. Like this again, they should be heated. Then you should observe under the microscope. So under the microscope, you can see the dark brown rhombic crystals. Of the hematine. So this is nothing but your dark brown rhombic crystals are there. Can you see here clearly? So this is the nothing but your dark brown Teichmann test. So my dear student, this is very, very commonly asked in the exam. That's why I discussed in detail about this. So Teichmann test, Takayama test, Barberio test, phenolphthalein test, KM test, luminol test, all these are very commonly asked in the exam. So yes. Okay. So we'll stop here. So we'll stop now. Tomorrow we'll discuss some more important questions tomorrow. So some more important questions tomorrow again. Okay. Any doubt in this today's class? Any doubt, beta? Any doubt in this? Dave Panda, Avnish Yadav, serotonin. Any doubt in this today's lecture? So tomorrow again a session. So just to tell you about the important topics in forensic medicine, we'll start from tomorrow 5 o'clock. Any doubt you can ask me. Any doubt now? If you have any doubt, you can ask me. Yes. Also, it's very good class. Avinash Yadav. Okay, thank you, beta. Thank you. Divine, amazing lecture. Thank you, beta. Thank you for the compliment. Divine. Yes. Just waiting for your comments. Yeah. Okay, Divine. Thank you. Divine. Serotonin, any doubt? Serotonin. Swapnashri, any doubt? Swapnashri. Yes. So we discussed all the important tests related to blood stain. Okay, this is what important table. So this is a very important table. You must know that can be asked in upcoming FMGE exam. Yes. With this now, stop the today's class. Continue tomorrow at 5 o'clock. Some more important finding and some more important clinical scenarios.